In the event that a cut on your skin expands, becomes red, and damages, those indications are of intense, or brief, aggravation. Feeling hot or losing capacity might be indications of irritation from another mischief to your body. Some aggravation that happens in your body's cells or tissues might not have outward manifestations. Aggravation is an ordinary piece of the body's protection from injury or disease, and, thusly, it is valuable. Be that as it may, irritation is harmful when it happens in sound tissues or endures excessively long. Known as ongoing irritation, it might endure for quite a long time or years. Irritation may result from numerous components, for example, natural synthetic compounds, wounds like scratches, bug stings, or a splinter in your finger, microorganisms, germs, like microbes, infections, or organisms, radiation. Irritation assumes a vital part in numerous illnesses, some of which are getting more normal and extreme. Ongoing fiery sicknesses add to the greater part of passings worldwide. 1. Aggravation is related to sicknesses like the accompanying immune system sicknesses like rheumatoid joint pain, cardiovascular sicknesses like hypertension and coronary illness, gastrointestinal problems like provocative inside illness, lung illnesses like asthma, psychological sicknesses like gloom, metabolic illnesses like type 2 diabetes, neurodegenerative illnesses like Parkinson's sickness. A few kinds of malignancy, similar to colon disease. What is NIEHS doing? Expanding Proof recommends natural components add to constant irritation. An audit of logical writing directed by NIEHS-supported specialists partnered with the National Toxicology Program discovered the climate assumes a part in aggravation in both positive and negative ways. For example, natural synthetics, the Government Toxicology in the 21st Century, or Tox 21, program shows how synthetic substances we normally experience may change atomic pathways that underlie aggravation. Nourishment, diets high in refined grains, liquor, and prepared food sources can adjust gut microbiota and lead to intestinal and resistant changes. Microbiome, studies of different microbiome uneven characters and sickness states show associations with irritation. Social and social changes, disrupted rest designs, psychosocial stress, fake light, and different elements impact the SAFE framework. Formative roots, childhood stoutness, mental pressure, openness to organisms at the outset, and pre-birth conditions are connected to irritation. Active work, when skeletal muscles contract, they discharge proteins that can lessen irritation all through the body. NIEHS analysts and grantees are investigating approaches to foresee, forestall, and treat fiery infections. They are contemplating the hidden reasons for fiery infections, creating investigations to analyze the provocative impacts of current and arising natural dangers, and testing novel systems to treat ecologically instigated aggravation. The following are instances of late discoveries. Constant liver aggravation and malignant growth. By smothering one of the body's normal instruments to battle disease, persistent liver irritation can prompt another tumor advancing pathway. This revelation may advise liver malignancy treatments. 3. Nanotechnology and lung irritation. Silver nanowires, which are utilized in close-to-home consideration items, food stockpiling boxes, and PCs, were taken up by cells in the lungs of rodents, prompting lung inflammation. 4. Ozone and cardiovascular illness. Exposure to ozone, even at levels lower than the current U.S. Ecological Protection Agency, EPA, air quality norm, may prompt cardiovascular disease. 5. Air contamination and diabetes. The diabetes drug metformin may diminish irritation set off via air contamination openness by forestalling invulnerable cells known as macrophages from delivering a provocative particle called interleukin 6.6. Aggravation and Parkinson's sickness. Blocking a cerebrum compound called dissolvable epoxide hydrolase in mice helped control the irritation related to the turn of events and movement of Parkinson's disease. 7. Natural stressors and life expectancy. NIEHS researchers exhibited that fiery reactions to ecological stressors can decrease life expectancy, supporting a hypothesis that lifespan relies upon a harmony among favorable to and calming proteins. 8. B nutrients and air contamination. Taking B nutrients may help reduce the impacts of fine particles, a typical air pollutant. 9. Prostate disease among specialists on call. Changes in irritation and safe guideline from openness to World Trade Center residue may have expanded prostate malignancy movement among that specialist on call. Please remember to subscribe, like and share.